Is AI reinventing healthcare by putting people, not paperwork, at the center? Well, welcome to the transformative age of breakthroughs powered by technology and to the HumanifAI HealthTech podcast. Welcome to the HumanifAI HealthTech podcast. This is where we explore how AI is already rewriting the rules of healthcare and putting people right back at the center where they belong. I'm Francesca Vereb, head of marketing at NetHealth. And like so many leaders in this space, I'm just trying to make sense of what AI really means for the people behind the systems. Because here's the truth, AI is transforming our technology. It's transforming our abilities, the way we work, the way we think. It's changing us. And for the first time in a really long time, the people, not paperwork, are right back at the center of care. And that's the wonder and the opportunity of this moment, the next revolution, so to speak. So today, we're kicking off a conversation about hopes and fears that are driving an era where miracles might seem to be a little bit more possible to achieve. And we're going to discuss the opportunity of using AI to bring the human side of healthcare a little closer and a little bit more forward into focus. Joining me today is someone who has spent her career at that very intersection, Dr. Geeta Nayyar, physician, technologist, author, and chief medical officer. Dr. G, it is such an honor to start this journey with you today.
Wonderful to see you, Francesca. Thank you so much for having me.
So tell us a little bit about the fact that you're seeing really great innovations that are happening on the forefront. Start out by telling us a little bit about you, and then tell us about what you're seeing as you talk to clinicians and administrators, nurses, and executives on how they should be thinking about this new age that AI is facilitating.
You bet. So, you summarized it really nicely, but I've been the chief medical officer for big tech, primarily at Salesforce, then AT&T, Greenway Health. I've had a number of roles doing exactly this and really sitting at that intersection of business, medicine, and tech. I'm also a best-selling author of Dead Wrong, Diagnosing and Treating Healthcare's Misinformation Illness. And so I think this is really the topic of the day, right, Francesca? Everyone is so excited. You can't go anywhere without hearing something about AI. It doesn't matter if it's a conversation at your organization in the hallway or a conference or an event or frankly your neighbor. And I think it's really a combination of excitement as well as a lot of fear and anxiety and understanding what it will mean both for the workforce as well as for us at home, right?
I think that's such a fantastic point. I was just recently at a dinner with a bunch of executives from our organization and a couple of other outsiders. And when you say fears, my CTO started out the conversation talking about how AI potentially could take over the world and, a little bit dystopian. I don't know if you've seen the Blade Runner movie, at least the first edition, which shaped me as a human, Geeta, I have to be honest. Um, and so there's a little bit of fear there. But then towards the end of the conversation, he was really talking about how new boundaries are going to be broken with AI and talking about things like, life that could be extended beyond what we think possible today and diseases that could be cured. And so when you start to think about that and you start to think about how AI is actually being used in healthcare, pretty exciting innovations that are at the forefront. So tell me a little bit about what you're hearing. What are you talking about in circles that you're in? What's the temperature out there and what's really going on?
Sure. So, let's answer all of that together, right? Because it's really about the hype versus the reality and then backing into what is actually happening in real life. So, the hype, we pretty much discussed it, right? Which is AI is coming for your job. AI is going to take over all of humanity and, it will only be robots roaming the earth, whether it's Blade Runner, iRobot, you name it. There's a movie about it or there will be. But the reality, Francesca, and you and I both know this, is that 75% of all medical communication in healthcare is happening via fax machine. To this day, even in the era of AI, even in the era of digital health. And so I think we have to balance it with this understanding that AI is only going to be as powerful as the data we can give it. If AI is flying blind, And the chart, the new digital chart actually says more than what is actually true. And I have a million examples of this. The patient with a blatant COPD chest x-ray, in his chart, it says he's a non-smoker, but his x-ray clearly shows that he's been a pack-a-day smoker for 20 years. When I look at that, Francesca, I'm Dr. G, I've been seeing patients forever. I say, hey, John, when did you quit smoking? And he said, oh, 5 years ago, right? But before that, I smoked for 20 years. Somebody copied and pasted the last note, which said he was a non-smoker, right? And the truth is, if you had AI look at that chest x-ray, they would have come up with a really different diagnosis than I just did. Right. And that's that human judgment piece. And so the reality is there's data gaps, there is judgment gaps, empathy gaps, right? Now, what AI is really good at is automating really simple, mundane tasks. And the good news is we have so much of that in healthcare. The prior auth, the documentation, the simple stuff, not as provocative, not as sexy as iRobot or Blade Runner, but it will and could go the distance for us and also save millions and millions of dollars and millions of frustrations in that trusted relationship between doctors and patients.
So, Giddy, you bring up a great point, but first, I cannot believe you actually brought up facts in a conversation about AI and modern technology. And it is ironic. I have heard it said that the healthcare industry is the sole industry that's keeping the fax machine alive. So I believe it. You bring up some really interesting points. Last week, there was a lot of news about job layoffs. Some of it either directly attributed to AI, some of it indirectly attributed to AI. And then we're talking about automating, regular routine kind of roles. So how do you think about that? How do you think an organization in the healthcare space should be thinking about that? How should a private practice or a clinic be thinking about that? How does AI help and support folks that are going through and seeing all these news headlines? What is your recommendation in that particular scenario?
Sure. So again, we've seen this with any innovation that has happened over time, right? And the reality is there will be transition. There will be a need to upskill and retrain the workforce. But I think what we're going to find with this new era of AI is that organizations that keep the problem in mind, which ultimately every healthcare organization to me is about driving patient outcomes and at value, right? Not expensive care, but high quality care at the best value at the best price point. So I think keeping an eye on the goal is really important, on the problem, but then also your organization and the culture of your organization and what you're about, right? And we are in a human services business. So if it is about keeping the humanity in care, if it is about improving the doctor patient relationship, there's no question about it that we will need AI partnered with humans as we continue to deploy it because there's so much we don't understand. So how you treat your employees, how you upskill them, how you transition them, how you are transparent with them about the changes that are coming, and also enlisting them to help solve the problems because so much of this is still very experimental.
Yeah, I mean, look, we've been here before, right? I mean, you think about, the steam engine, you think about electricity, in more recent times, internet, what did that do? How did that shape things? What new jobs did that sort of develop and bring onto the workforce? But you also bring up a really great point, Geeta. I've been through a situation where my daughter had to go through a lot of surgery, right? You spoke about the human side of things, and you've spoken a lot about automated tasks and things. And I have to tell you, when you're sitting in that patient room and you've got your family member and you're looking for answers, and you've got that doctor, that, therapist, that practitioner that's in there, that's looking you in the eye and not hiding behind a screen or hiding behind a chart, not because they want to, but because, we've taken healthcare and added so much administrative burden onto these people. But I have to tell you, there's times when there's real fear from that patient's perspective. And when you can look and trust that doctor and trust them to kind of guide you through the flow, that really makes a huge difference. And that, I think, is kind of what I think you're teasing out here is healthcare is about the human, right? And so tell us a little bit more about that. I know you speak a lot about this on your various keynote speeches and in your books, but put a finer point on that for us.
You bet. And I mean, you nailed it. And I hope your daughter is doing well and is home and doing better.
Thank you. Yes, she is.
Good,
Thank you. Thank
good.
you.
Good. So, look, again, this starts with the problem. And I think too often when you talk to technologists, as I am out there on the speaker circuit, they always start with the problem as such. They say that the Physicians are expensive, nurses are expensive, the workforce is burnt out, they're not empathetic, and therefore they want to put AI on those problems to replace the doctor and replace the nurse. What I say to that is that's the wrong problem to solve, right? Because the reality is patients want the human interaction, the workforce wants the human interaction, but they're bogged down with so many mundane data entry tasks that the real question is how can you use AI to augment the workforce? How can you use AI to take those tasks, to take those 10 menial tasks off the plate of the doctor and nurse so they can focus on the actual patient care and focus on practicing at the top of their license. And when you do that, you will find an efficient and more valuable workforce that's happy and also feels a trusted relationship with the organization and isn't going anywhere because retention is also a big part of the issues around the workforce. So I think there's any number of low hanging fruit, but it's arguably in the non-provocative things like prior auth, clinical decision support, documentation, patient care, diagnosis, and therapy. That still very much requires doctors and nurses being in the loop because so much of it is empathy and judgment, which we know is not the strong suit of artificial intelligence, right? Data entry, automation, analytics, repetitive tasks. These are things AI is really good at. Humans are not so good at that. Humans also need to sleep. AI can go all night long, right? So being really mindful of the strengths and weaknesses of the human workforce and the AI workforce and how you do that to really augment the human factor. Well, I think that's what this podcast is about, but I think that's what the name of the game in healthcare is about.
Geeta, it's one thing I'm always reminded of is whenever I get you on the phone or I have an opportunity to chat to you, at the conferences, etc., we dive right into the key heart of the issue. And I think what we should actually do for the audience is probably take a few steps back and maybe define like what is AI? Like tell us a little bit about that first of all from the healthcare perspective. But then I want to dig into some of the key points that you just made around technology and enabling those those practitioners and those clinicians. But yeah, define it for our audience.
At a high level, it's really an area of computer science that is focused on substituting human intelligence, right? By using data, by using machine systems, essentially this idea that artificial intelligence is really substituting human intelligence, right? And so at a high level, that's what AI is all about. It's being able to do the tasks, being able to do the analytics, and being able to even predict going forward, did you want to do X, Y, and Z? But at a high level, it's really about human intelligence and being able to mimic that for us.
So, Geeta, you gave that example earlier about the chest x-ray and that diagnosis, right? Do you believe that AI there is really substituting human intellect and those human qualities, or is it just something that's as a catalyst or sort of augmenting?
Well, if it's all in how we implement it, right? But we are seeing organizations as they deploy it, they're not, right? We're still learning. So some that are trying to replace, like I said, the doctor, the nurse, they take the information and they're asked to come up with a diagnosis. Now, understanding there are gaps in the data you are feeding the technology and that the diagnosis may not be correct is why I believe you continue to need a human in the loop, right? But there are places and organizations that are saying, yeah, you've got it. What would you do if you were the human in charge? And I think that is not the correct way to use AI, but that doesn't mean that it's not happening, right? And so being mindful of where you are pointing and shooting the technology and what are the ramifications of it? And then what is the workflow for when you need a human in the loop, right? Because if 90% of the time you're correct, that's great, but what about the 10% of patients that get a wrong diagnosis? And that's why you want to be really mindful that for those, a final diagnosis cannot be made without the radiologist, without the pathologist, without a final approval. And I'll give you a really simple example, AI aside. I mean, medical training, residency. I did 3 years of residency, 2 years of fellowships. The more senior you get, you see patients completely on your own. But guess what? You can't sign off on the diagnosis or therapy without your attending a full-fledged physician taking a look. And let me tell you, 9 times out of 10, we're right as the senior resident or the senior fellow, but it's just the one time that you could be wrong. And that is why we always have that senior attending. And I don't think of AI any differently, at least in the clinical space, right? At least when we think about making clinical decisions, because the stakes are too high, the liability is there, the regulatory pieces are there. And that's certainly another part to this is how you bill for it, right? And so we are also at a place where we have the technology, but the systems and processes in healthcare are not keeping up. So if the diagnosis is wrong, who carries the liability? What is the regulation around that? I mean, there's a million more questions that we open up, which is why I think, again, the human in the loop, at least on the diagnostic and therapeutic side, is really critical.
Yeah, I think you're absolutely correct. I think there's real power in leveraging AI, right? And I think it's that data, that machine learning, that ability to sort of help support us. And really, it's framing patterns and behavior based on human inputs. And so, I mean, AI is not thinking, at least not yet. That's my Blade Runner dystopian kind of fear coming out there. But I do believe that what you were talking about there from the workflow standpoint is so critical because think about like that single mom, right? Who is working in a clinic and is spending 3 4 hours a night running and putting in documentation, and she can't get home to spend time with her children because she's busy finishing up patient charts, etc. If AI can get her to get home a little bit earlier so she can spend time with her kids, that's a pretty human powerful story. If it's taking complex data and helping that clinician get to a potential diagnosis a lot faster, an assisted diagnosis. I totally agree with you, Geeta, that human in the loop is so key. That's power. I think what is interesting though is taking AI and embedding it into those key workflows to help and facilitate the human interaction around that patient. That's really for me what that big power sort of comes in. And I love the fact that you talk about patient engagement because being a marketer, yes, we tend to get all excited about the scientific things that AI can bring to us and can sort of take off our plates. And sometimes we get so tied up in that we forget that we're actually having a conversation with humans in the space. And I think healthcare has some parallels in that same universe. So it's sort of an interesting play. I think it's both super exciting, super empowering, but I also think some organizations, to your point, really need to stop and think about which workflows does it make sense to embed AI within, and then really monitor those and make sure that those outcomes are being delivered. Wouldn't you agree?
So 100%, Francesca. And really, it starts with understanding the problem, right? And I'm going to give you some simple examples. What happens when you go to the doctor's office? I'm sure this happened when you went in with your daughter. And if you went to the appointment 3 times, every time you went to that waiting room, they handed you the same clipboard. And what did they ask? Your name, your date of birth. And let me tell you, as many times as I want my date of birth to change, it ain't changing, okay? It ain't changing, right? And every time
Well,
I
you
go,
do that
someone
too.
and every time I go, someone puts in an extra initial in my name. Geeta becomes Greta, right? I mean, patient engagement. To me, patient engagement starts with that appointment, right? Starts before you even get to the doctor's office. Those tasks could be so easily automated. And I would feel so delighted as a consumer of healthcare if when I walked in, I was checked in just like at the airport, right? You got my name, you got my date of birth, you know who I'm here to see. Check. Right? My address hasn't changed. Very quick ways that takes that friction point of sitting in that waiting room for sometimes 30 minutes or an hour, depending.
Well, Geeta, there's also the before, right? Making sure that the prior authorizations are all done, or even
100%.
post appointment, right? If they know a little something about my daughter, for instance, send me a little note about that, or follow up with something that's prescriptive, right? So it's that 360 view is what you're teasing out, correct?
That's the goal. That's the goal. And that, I think about this as pre-visit, during the visit, and post-visit, but the 360 is all of that, right? And then leaving the doctor-patient relationship for the humanitarian things. But then post-visit, exactly. Francesca, you didn't pick up your medication. We see you didn't make your appointment or you didn't even make an appointment in the past 6 weeks when your doc recommended it, right? Using AI and those algorithms to action those things, to also action patient education and marketing as we continue to live in this era of mis and disinformation. There's 100 ways to use AI outside of the examining room, and yet we're so focused on using it in the examining room, which is much more nuanced. right? Much more nuanced. Now, I do think a lot of the ambient AI technologies around documentation are finally going to help us get the documentation piece right. But it still is very difficult to imagine that being on autopilot. Things get misunderstood, things get lost in translation, there's language barriers, there's all kinds of things, right? So while I do think it will move the needle, I don't think we're at a place where it's going to be autonomous yet. But do I think we could do the check-in process? Do I think we could do the discharge process more or less autonomously? Absolutely. Do I think it would be a crowd pleaser for the doctor and the patient? Absolutely. I mean, to have my appointment ready to go, to have those things, reminded to me when I miss them, those are things anybody can find useful, and find those as normal regular pain points on why we see a lack of compliance either in prescription pickup or in follow-up. And one piece that we don't talk enough about, frankly, is the financial component, right? What happens when you leave the doctor's office? What happens when you leave the hospital and you get that magnanimous bill that nobody understands, and yet is $10,000 when you never even anticipated it would be close to that? What happens is patients freak out and they never want to go back to the doctor again because they can't make out the bill. Often they're told, don't pay the first bill, wait for a few bills for it to get reconciled and corrected. That doesn't do anything for trust.
You make such excellent points. And I think that whole point of trust is just such a key thing. I think because the healthcare industry has been burdened by all this administrative burden and, just the compliance and just the all the check boxes that they have to sort of go through. It has removed that opportunity to, as I was saying earlier, look the patient in the eye. But there's also, with AI, I think there's also this advent of putting some power back in the patient, right? And sort of changing that trust dynamic a little bit between patient and doctor, provider, clinic, etc. And I'm sure, you've got a young daughter, I have one too, and, everything is TikTok and all this online advice, which they trust more than proper medical research. But tell me a little bit, Geeta, when you have a client or a patient, I should say, rather, who walks in the room and says, I did my own research. Does that worry you a little bit? How do you think about that? Do you think that's sort of empowering the patient? And how do we address that in this new modern age? Because it's inevitable, correct?
It sure is. It sure is. And increasingly, that's the beginning of the conversation is, hey, doc, I did my own research and, this is what I think, or what do you think, et cetera. And so I think there's two sides to that coin, right? The first one is in a post-pandemic world, I think the consumer of today is hungry and thirsty for everything health related. They never want to be caught off guard. They want to live to be 100, right? And I find all of that truly exciting that the consumer is wanting to be healthy. Where this becomes dangerous is in this era of TikTok and this era of AI, is that for the most part, subject matter experts like those of us in healthcare are quite silent, right? Namely for liability issues, namely for cultural issues. We in medicine have never thought of marketing as important. You know that, Francesca, right? It's always been a nice to have, not a must have. ER's full. Why do we really need to market, right? But in today's world, what has happened, we've left a huge gap open for what I will just say are influencers, right? And they are really victimizing our patients because they are excellent communicators, far better communicators and marketers than we are in healthcare. So when they have that inspiring message, when they've got those cool dance moves, Francesca, and that supplement is just $9.99 if you want to live to be 100, or that home kit is $9.99, subscribe here, forget about a mammogram, forget about a colonoscopy, it becomes really hard not to be inspired by those folks, right? And so often the consumer is going down that rabbit hole because they don't have a doctor or they don't have an organization that they trust, and or that doctor, that organization doesn't communicate with them, doesn't speak to them in an inspiring way or at the right language level. And so I think that's the opportunity that we're in now. I frequently have this conversation with patients, which is to say, hey, I'm so happy that you're excited to read about this. Here are the sites that I recommend. We often understate the value of patient organizations, American Diabetes Association, you name it, Lupus Foundation, Arthritis Foundation. I'm a rheumatologist. I frequently cite those organizations. Those are critical. And look, social media is where we're all at. Francesca, I follow Dr. TikTok too. And I tell my three favorite real Dr. TikTok friends, and I give them them to my patients and I say, look, these are real doctors with real licenses. They're accountable for what they say. So part of this is health literacy and helping our patients understand who they're following, what they're reading, how to check if things are in fact true. Guess what? You can use AI to fact check. AI can fact check the organizations that you're looking at. And so I think there is a huge shift that needs to happen on top of the importance of marketing.
To your point, this isn't like the old times that, hey, I'm a doctor, go find somebody, you're a trusted, patient network, and it's within a 15-mile radius and people are going to come. Now the competition is pretty severe. So as a private practice, as a clinician, gosh, even from a, big IDNs, big healthcare systems, there's heavy competition out there. And I think you're right when you say leaning in a little bit more, really embracing, understanding, and recognizing patients are more actively involved. They're advocating more for themselves. They are doing online research. So embrace that. Leverage the AI to help you with some of those pieces, but own your own content, right? And own your own conversation out there. I think that's a really key point to for people to hear.
100%. And I think just like the two of us are talking, right? It really requires that partnership between clinical and marketing and making sure that, you're the marketing expert. So let the marketers do what marketers do and the clinical people saying, hey, here's the three things I wish every one of my patients with, a level 3 wound had. Or these are the 5 things you need to be mindful of when, you're going to a rehab facility. I mean, the clinicians can come up with the content, but how wonderful to partner with your marketing organization and just recognize that the silos of healthcare have never worked, but this is a particular unique one where I think that clinical and marketing partnership is important because I want to be careful that we're not asking our doctors and nurses to now become social media experts, right? We want them to be the best doctors they can be, the best nurses they can be. Leave that to the marketing team. But using that content creation and that strategy and that partnership is where I think it can be really valuable. And I think organizations need to pay their workforce for their time. I also want to be mindful that we're not saying, hey, do this just in your spare time, because there's really not a lot of spare time. But for influencers who are out there, I will tell you that the reason they do it is because they have found it a booster to their practice, and they have found it to be a way for patient acquisition, retention, brand loyalty. Again, all things in your space, but I think organizations that realize that there is an actual ROI to combating this and disinformation, but more importantly, if you're interested in consumer experience, if you're interested in trust, if you're interested in value-based care, this is critical to it, right? Because if you don't know what a mammogram is, you're certainly not getting one.
It's just interesting that these two polar opposites, right? Your marketing folks who are out there selling, quote unquote, and you've got your healthcare providers that are healing, now being unified around this notion that the human, the patient, is sort of the center. So it's very interesting that a technology is actually unifying us around this central theme. And I think that that's super empowering. Use the AI to empower your teams. Use the AI to do sort of the scientific side of marketing, the data analysis, the understanding of your clients, the targeted assessment, managing some of those workflows, like you said, in terms of communication, etc. Automating, leaving time for the true craft in our case, or for the science and of healing in your case, right? And sort of that parallel life that we're living is really just interesting. I mean, I'll give you some examples, just practical examples from a marketing standpoint. We have spreadsheets that we're trying to assess and analyze. I had a junior marketer that actually approached me the other day. It was Friday, 4:35, and she was panicking because she had just been dumped a spreadsheet or a whole bunch of data that she had to put into a spreadsheet. And I could just see in her face, she's thinking, oh my gosh, it's going to take me 6 hours of manual data entry. I kind of looked at her and said, why don't you just take all of that and just dump it into ChatGPT, right? And she did that. Took her 10 minutes. She still finished her day's work on time, but now she had the mental space to be able to actually look at the data and have the data tell her what she really needed to learn from it, as opposed to taking the 6 hours of doing data entry and just being completely confounded and exhausted at the end of it. And I think that parallel scenario is similar with our healthcare providers, right? And you were talking about trust with patients, billing, you're talking about all these different scenarios. To me, it feels the same way. It's these healthcare providers that are being burnt out. We know that there's still a chronic staffing shortage. So use the AI to help you in those kinds of workflows so that you've got time to do the things that you actually came into the healthcare space to do, which is really looking after those patients, healing folks, making sure you're focusing on the things that make sense. And, so within all of this context, there is a lot of this notion of AI hype versus the true reality, and understanding what is really going to move from, hey, a pilot and there's a nice idea, into actual, true, practical workflow. So I would just be interested in what you're thinking and what you're seeing in these scenarios, particularly in the practice settings of like clinics or home health environments, or even hospitals, like, and specialized care, right? Thinking about wound care or sort of a rehab therapy space. What are you seeing there, and how do you reconcile this hype versus reality piece?
So, look, I think you bring up some excellent points. And I think the reality of how we move the needle is just being really thoughtful, zooming out, again, technology aside, but zooming out and understanding what are the problems for your workforce, for your organization, if that's a rehab facility, if that's a wound care center. What is the workflow? What does the workflow look like? And then what are the top 50 things that your staff hates, right? That for the most part are mundane, easy to automate, et cetera, right? And then you dissect that 50-point problem list into the top 10 that AI could potentially help solve. And you go from there, right? But I think it's really important to understand, what does a day in the life of your organization look like? Then what is the day in the life of the workflow and the staff? Because ultimately, this is very much about the doctor-patient relationship, the care team relationship with the patient. So that's why the staff piece is important. The workflow piece is important. Just using AI as a silver bullet, it's not going to work. And we've seen that from any number of innovations in legacy systems in healthcare. The electronic health record, most recently, right? Creating 5 new problems, but solving 3, right? We found ourselves with new problems that we didn't even anticipate. And so understanding that and going slow and methodically, and to clinical leadership, because if you are trying to either reduce your FTEs or help augment your staff, you need to involve them. You need to involve them in which problems you've decided to solve, how you are deploying AI, then getting feedback from them on what is working, what is not working, what did you not anticipate that you now need to anticipate, right? So that clinical leadership, that workforce leadership is a critical one, and one that we typically leave out till the end. And then one we may not often think of is regulation. Regulation advocacy in this space is going to be critical. What is AI going to look like in the healthcare space is largely unknown. There are many folks out there lobbying, big tech certainly being one of them, and making sure that doctors' voices are in there, patient voices are in there. What should or shouldn't it look like in the wound care rehab space? It is important that that advocacy component is part of how we think about this, because either way, we are going to have to deal with this. And so understanding things around privacy, security, cybersecurity, how all of that is going to play out, I think is imperative for our industry to weigh into what we will ultimately have to deal with. We continue to be a highly regulated industry, and if we're not part of those conversations, it will be thrown on us like so many other legacy systems in tech.
Geeta, regulation and advocacy for responsible AI is just such a great point, and probably a great idea for a future podcast. Okay, I'm afraid, folks, this is where we're going to have to leave it for today. Although, Geeta, I could talk to you for ages about this topic. So, just to wrap here for our listeners, a couple of key takeaways. AI is definitely here, and its usage is going to become even more prevalent. AI also has this great power to be a catalyst, particularly in healthcare organizations where automation is going to help that care team really focus more on the patient. Also, those inevitable healthcare conversations continue to happen online, and increasingly so in social media, particularly TikTok. So, healthcare clinicians and providers really need to lean in and own those conversations. And a great tip from Geeta was to partner with your marketing team to help you there. And finally, healthcare leaders, you play a huge role in supporting and driving AI adoption. And there's actually a great report that NetHealth and Becker's did on this, and we'll drop the link in the show notes for those listeners who are interested in checking it out. Now, if you're tuning in from Spotify or YouTube, we'd love to hear your thoughts on this episode. And please leave us a comment, and don't forget to give us a rating while you're at it. And lastly, thank you for joining us on the HumanifAI HealthTech podcast. This is where we're going to continue to explore how AI is already rewriting the rules of healthcare and putting people right back at the center where they belong. And once again, I'm Francesca Vereb, Head of Marketing at NetHealth, and I'll see you next time.